Hi and welcome back. Today we're going to talk about obstructive sleep apnea. So, what is obstructive sleep apnea? Glad you asked. It is a very predominant condition that can affect up to 30% of males in the United States. The number is lower in females until they go through menopause, and then they rapidly catch up with the men. What happens in obstructive sleep apnea, which I'm going to shorten during this segment and just call sleep apnea because it's easier to say, is that the airways collapse and keep you from breathing while you're asleep. When that happens, your oxygen level dips. That's when we have an apneic episode. These are often brought to attention by loved ones, your bed partner, your spouse, or others in the house are usually happy to tell you that you snore loudly and wake them up. But often, they will also notice that you stop breathing or that you gasp and choke to wake yourself up. People sometimes are aware of this. They'll say, I wake myself up, choking and coughing, but much of the time, they are not aware of it. The hallmark of this is excessive daytime sleepiness. Just feeling as tired in the morning as you were when you went to bed the night before. People feel like they might get 10 hours of sleep, but they don't feel rested at all. In severe cases, people will find themselves nodding off during important meetings, after they've just sat down to watch television or in a quiet room, or if they're driving or other important times. And this can be very dangerous, not only for that person, but for other people who might be affected. In addition, sometimes people with sleep apnea can actually die in their sleep if their body doesn't stimulate the response to arouse a little bit and either change position or start breathing again. Who gets sleep apnea? Well, it can happen in anybody. If you have airways, they can potentially collapse at night while you're asleep. We generally see this in people who are significantly overweight. In men, if you have a neck circumference of 17 inches or greater, the likelihood is very high. In women, that's a neck circumference of 16 inches or greater. How is it diagnosed, you ask? Glad you asked. It is diagnosed with a sleep study. For straightforward cases that we're pretty sure is going to be a slam dunk, we can do a home sleep study. For people who are more complicated, they often need to go into the sleep lab to have the test. The issue with having the sleep lab test is that a lot of people who already have a sleep problem won't sleep a wink when they're not at home in their own bed. So if we can do them in home, that's optimal just for patient ease. Sleep apnea can affect essentially every aspect of your life. It either directly causes or contributes to fatty liver, independent of your weight. It can worsen diabetes. It can cause worsening or can cause high blood pressure, coronary artery disease, congestive heart failure, can also affect your mood, so can cause depression or other emotional problems if it's not treated effectively. One of the most important things that I see in my practice is weight loss. I tell people all the time, if you have sleep apnea and it is untreated, good luck losing weight. Until we get that treated, it makes it so difficult to be able to lose weight. People are hesitant to get a sleep study because they don't want to do the study and they don't want to find out there's something wrong with them, and they certainly don't want to sleep with that machine on. But time and again, my patients, friends, and family come back and tell me, I didn't realize what a fog I was walking around in until I got that machine. Is sleep apnea really that big of a deal? Yes, it is. Don't be a knucklehead. Listen to your doctor. If you're not going to listen to your doctor, listen to me. If people are telling you that you're snoring loudly or that they think that you are stopping breathing, if you're significantly tired, or if you have one of those conditions and just can't get it under control and haven't pursued the sleep apnea idea, please do. I think you'll feel so much better, and it will probably make your other conditions much easier to treat. How do we treat sleep apnea? Another good question. You're really engaged in this discussion, I can tell. The gold standard is CPAP therapy, which is continuous positive airway pressure. Some people, if it's significant enough, need BiPAP, but it's a machine that goes over either your nose or your nose and mouth and provides pressure to keep your airways open. It's the machine that people love to hate. It takes some getting used to, but can make a difference and can save your life. If you can't tolerate the machine, which I highly recommend you do, there are new machines, there are new masks always coming out. Just work with the company and figure out the right one for you. If you cannot find one that works, sometimes just positional therapy, either sleeping on an incline, whether your bed does that or you get a wedge pillow. Sometimes sleeping on your side helps keep those airways from collapsing. For some people, losing weight is a big part of this, which may be difficult unless you have your sleep apnea treated. But I've seen many people chuck the sleep apnea and totally get rid of it by a significant amount of weight loss. Refer back to my weight loss videos for help on that. Another way, if you have great big tonsils, they might be crowding your airway, and sometimes having them removed can make a huge difference. There was, about 20 years ago, a real craze of having the back part of the soft palate removed so that it wouldn't flop and collapse. It really has fallen out of favor a bit, but is also an option for some people. There's also an appliance called a Herbst appliance that can help push your jaw forward and open the airways. Some people find a lot of help with that too. There's also a new device called Inspire that's an implantable device that helps to keep your soft palate from collapsing at night. There's a little pump thing that you turn it on with and it deploys, and the people who've tried it really seem to like it. It's pretty new on the scene, but there's a lot of promise in that as well. But seriously, Dr. Mindy, is it really that big a deal? Yes, yes, yes. Please, if you listen to nothing else I say, don't be a knucklehead. Get your sleep apnea addressed some way and potentially save your life. I've had more than a few patients come back and tell me after having had a heart attack or a stroke or other big event, and they come back and say, Dr. So-and-so said I should have listened to you all those times that you told me I needed to get my sleep apnea checked out. It's so much easier to take care of on this side than waiting to pick up the pieces after an event. Please don't ignore your snoring and don't ignore your family members when they tell you about it. So, take this step and make a huge impact for the positive in your health. Like and subscribe. Don't forget to stay tuned.